Hi, I'm Pam Butler, and I'm sitting here in beautiful Kerala, India. And I'm sitting here with Paul Mills, who is a professor at UCSD. And Paul has just recently completed a study on the impact of gratitude and how gratitude can affect well-being, particularly in heart patients.
Yes, heart failure patients.
Heart failure patients. So can you tell us a little bit about that study, Paul?
Yeah, happy to. So I work in a field called behavioral cardiology, which is interested in the relationship between different types of behaviors and feelings and mood in the health and well-being of heart failure patients. Historically, behavioral cardiology focused more on negative traits such as depression and stress and hostility. And certainly there are relationships there in terms of the quality of life and even physical functioning of heart failure patients. The last decade or more, there's been a movement towards beginning to understand more of the so-called positive psychology or positive psychiatry in heart failure. So we just completed a study looking at one of the positive attributes called gratitude. And this project involved studying heart failure patients as they're going through their normal treatment at the cardiology clinics. And we administered a variety of questionnaires to them, including those on gratitude. We also sampled blood to look at different biomarkers of cardiac function, and then also looked at their medical records to see how they're doing. And essentially what we found is that those patients who had innately more trait gratitude were healthier than those patients who did not. Not only healthier emotionally and mentally in terms of less depressed mood, less fatigue, they had better sleep, they also had better physical functioning as a patient, and they also had lower levels of the so-called inflammatory biomarkers, which are very predictive of future clinical course.
Right. So when talking about gratitude, how did they incorporate that gratitude into their daily life? What were some of the practices that they did? Was it, the positive mind speak? Was it journaling, a combination? How did they introduce the gratitude?
Yeah, great question. So what we did is we conducted an intervention which involved assigning the patients, at least a portion of them, to journaling about gratitude every day. And we asked them to write into the journal 3 things that they are grateful for, and to do this most days of the week. And we had them do it for 8 weeks. Okay. And so half the patients in this study were assigned to do that, and the other half of the patients were assigned just to continue with their treatment as usual, with no specific focus on gratitude, no journaling.
Right.
And what we found is that those patients who did the journaling, they had significant improvements in their well-being, including their cardiac biomarkers, which are a function of how well their heart is doing, and again, also indicators of their potential future clinical course. And so those were biomarkers in the blood. And we also looked at a biomarker called heart rate variability, which is an index of how much variability there is of the heart from moment to moment. More variability is better. Less variability, not good. Less variability, poor clinical outcomes. So we found that those patients who did the journaling improved in their heart rate variability. Again, another indicator that by practicing gratitude through the journaling, by beginning to spend more time bringing that into their own consciousness,
right,
began to influence their biology as well, and a very relevant biology.
That's great. That's amazing.
Yes.
Great work. Thank you so much.
You're welcome. Thank you. There you have it.